Have you ever been told by your grandmother not to go outside with a wet hair because you might get pneumonia? Hello, my name is Francisca Menu. Today I am going to talk about pneumonia, or I'm going to inform you about pneumonia. Before I proceed, I would like to talk about the respiratory tract. Respiratory system infection is the number one cause of illness in the US. Upper respiratory system consists of the nose, pharynx, larynx, and the structures associated with them. Lower respiratory system, on the other hand, consists of the trachea, bronchial tubes, and alveoli. The lower respiratory system is almost sterile in exception of the trachea, which may contain few bacteria. So our bodies have their own defense mechanism that they use to prevent microorganisms or pathogens entering into our body. Somehow, some of these pathogens bypass the defense system and enter our bodies, which is the lung, the lower respiratory system. In the process, the white blood cells and the proteins try to fight it when we get these pathogens in our lungs, and in the process produce this fluid which normally fill the alveoli. That is pneumonia. Pneumonia is a pulmonary infection mostly caused by bacteria, Streptococcus pneumonia, also known as typical pneumonia, due to its symptoms that are more severe. Pneumonias caused by other microorganisms often have milder symptoms, which are called atypical pneumonia. Pneumonia can affect various portions of the respiratory tract. The first one is lobar pneumonia. Lobar pneumonia affects the lobes of the lungs. It can be one lobe, two, or all the lobes. The second one is bronchopneumonia, which affects the alveoli adjacent to the bronchi. That is where you can find this fluid, which are not supposed to be in the alveoli. The third one is pleurisy, which inflames the pleural membranes. Epidemiology. In 2014, the eighth cause of mortality in the United States, reported by the Center for Health Statistics, was influenza and pneumonia together. Pneumonia is also the single largest infectious cause of death worldwide in children. In 2015, pneumonia killed 920,136 children under 5, accounting for 15% of all deaths of children below 5 years old. Although there is much improvement in antimicrobial therapies, microbiological diagnostic testings, and prevention measures, pneumonia remains a serious public health concern and a major cause of mortality and morbidity. Considering the age of a patient, the environment, underlying causes, and predisposition, one can say pneumonia is a very dangerous disease. In 2013, the Global Burden of Disease Study, based on data from 188 countries around the world, reported that lower respiratory tract infection was the most common cause of death. Etiology. Globally, Streptococcus pneumonia is widely accepted as the common causative pathogen in community-acquired pneumonia, mainly significant with acute symptoms of lower respiratory tract infection, which is called typical presentation. In hospital settings, the common strain pneumonia causing bacteria include Staphylococcus aureus, Klebsiella pneumonia, Pseudomonas aeruginosa, and Escherichia coli, all of which are resilient because they are very resistant to antibiotics. There are well-established intracellular pathogens that are responsible for community-acquired pneumonia. This includes, but not limited to, Legionella pneumophila, Chlamydophila pneumonia, and Mycoplasma pneumonia. Modes of transmission and clinical presentations. Modes of transmission. Pneumonia can be acquired through community, hospital, environments, pathogenic aspiration, inhalation of pathogenic microorganisms. So someone may ask, I did not have pneumonia before coming to the hospital. How come I have pneumonia now? So patients who probably might use catheters and other hospital equipment are bound to have pneumonia, which are called hospital-acquired pneumonia. Signs and symptoms: high fever, chest pain, breathing difficulty, productive cough, inflamed alveoli, inflamed pleural membranes. Diagnosis: blood and pleural cultures. This has a higher specificity but low positivity, 8% to 20%. The spread of infection to the blood occurs less than 10% in cases. So this test might not be a proper or a specific one good enough for detecting pneumonia. The second one is urinary antigen detection. This one, the sensitivity for pneumococcus detection ranges from 50% to 80%. So this is one of the perfect ones that can be used to detect pneumonia. The third one is sputum stain and culture. With a good quality sample in community acquired pneumonia, the sensitivity with gram stain is 78%, which is mostly caused by Staphylococcus aureus, which is the causative agent. Treatment and prevention. Increasingly encounters the problem of penicillin resistance. So, because pneumonia, most of the pneumonias are very resistant to penicillin, there are other alternatives which include macrolides such as erythromycin, which inhibits protein synthesis, and fluoroquinolones such as ciprofloxacin. Symptoms management and rest are very important in recovery. A recovery process differs in patients based on age, pre-existing condition, and the kind of pathogens involved. So if we are talking about older adults, it takes longer than necessary for them to recover from pneumonia, and children under 5 as well. Also, people who have pre-existing condition like heart problem and other problem that are already there are prone to recover longer. Prevention. Pneumovax vaccine is mostly the main vaccine that is available that a person can get a shot and get prevention from the disease. It's mostly for adults who are at greater rates of pneumonia. Knowing more about the disease can also help prevent it. That is, if you know what pneumonia is, what is the cause or the kind that you have, that can help a person to prevent it happening. Taking care of the environmental contamination can also help prevent pneumonia. And then the third thing is minimizing person-to-person contact when infection is present. So if you know someone who is already suffering from pneumonia, you can minimize the contact to prevent it. In conclusion, identifying the causes and types of pneumonia is very crucial to treatment, considering the rate of multi-drug resistant pathogens and emergence of new pathogens, especially hospital-acquired pneumonia. Overall, community awareness programs, good personal hygiene like oral hygiene, proper nutrition, aerobic exercises, and abstaining from smoking can help minimize the rate of pneumonia and other respiratory tract infections. Thank you.